Morning, everyone. So we're back onto the COVID inquiry again, and yeah, I just want to recap something because there was a really interesting email that was provided as part of the evidence to the COVID inquiry yesterday, and you look at the front page of the newspapers, you think, well, this should be all over the front pages, shouldn't it? And it is not on any of them, as far as I can tell. Not a single one. There's like pissing Julia Roberts on the Daily Mail for some reason. But just to remind you what happened. So first wave, COVID, and the government were faced with a bit of a problem. And this is how I described it at the time. It was so obvious. There was not the capacity in the NHS. The Tories, over a great many years, have made sure that there's the bare minimum capacity in the NHS. There's no like extra capacity. For example, Germany, the reason why Germany were able to take COVID patients from, say, Italy and so on, is because their intensive care capacity was actually quite large. They had designed it for emergencies, not just normal use. Where we'd gone for is from having enough capacity to cope throughout the year to the government going, well, let's just have the average capacity, which meant that in winter there wasn't enough capacity, but the government, as far as the government were concerned, it's, well, that's okay. They'll catch up in summer. So that's where we ended up. Before COVID, this is what would happen. Every year we'd get an NHS winter crisis under the Tories, just like we did under Thatcher and Major. And it was based on the idea, well, during the summer they can catch up. They can just catch up. They can put off elective surgeries during the winter and then catch up over the summer. That was their thinking, right? Which is mind-boggling. But anyway, then comes along COVID, and all of a sudden you're going to need massive extra capacity, which just isn't there. Doesn't exist. So you're going to need to move people out of hospitals fairly quickly. And a lot of these people are elderly. And you think to yourself, well, where do they go? Some people, you throw them home, okay. But some of them live in a care home when they're not in hospital. So they've got to go to a care home. Now, what have you got in a care home? You've got lots of the most vulnerable people. When it comes to COVID, a lot of the most vulnerable people in close confines. You've got care workers moving between them without proper PPE because you also haven't sorted that out. So if you start discharging elderly patients from hospital into care homes, you need to make sure that they're not infected, don't you? So you do COVID tests. Only the government guidance at the time said there is no need for a negative COVID test to discharge patients from hospitals to care homes. And this is what I knew at the time. So I knew this at the time. I reported on this at the time. The government were insisting that they would throw in a protective ring around care homes. To which, it's like, so why did 20,000 people die in care homes then? Why did that happen? But that's what they insisted. It was obvious lies, but that's what they insisted. So then yesterday, we had some email evidence. So let's throw the first one up first. So, dear Jenny, this is referring to Jenny Harris, who was the head of the UK's Health Security Agency. So both of the people involved in these emails are officials, not politicians, but they were very senior and were working under the direction, effectively, of Matt Hancock, who, as someone has said in the comments, is due to give evidence today. So this is from someone, let's get their name, Rosamond Ruffton. So she's saying, dear Jenny, we estimate, this is referring to the fact, this is from June, I'm going to explain as well. This is from the 16th of March. So this is the first wave. The first wave is powering up. We're getting ready to lock down. We haven't actually locked down yet at this point. We haven't even locked down yet. We should have done, but we haven't, right? And they're talking about shielding, but also the fact that the government have got a policy of moving people out of hospitals once they no longer need the hospital care back into care homes without requiring a negative COVID test, because it was months before a negative COVID test was required. So this person saying, "Dear Jenny, we estimate that approximately 2/3 of people in care homes are over 85. When we introduced the shielding policy, by the way, being the opposite of shielding, it's moving people from hospitals to care homes. What should our approach be to allowing patients to be discharged into care homes who are symptomatic of COVID-19? Now, before I go on to the next bit, I just want to point out here, remember at the time, the government were trying to go on about this idea of, if you've got, as if you didn't have symptoms, you didn't have COVID. Yet we knew that there was asymptomatic transmission because that's how it got around the world. The fact that symptoms often didn't present themselves for days after you were infected and infectious. So what they're acknowledging here is if someone doesn't have symptoms, they can get away with it. Oh, they ain't got COVID. But they're now saying, because care homes are concerned, what if you send one of their residents from hospital to them and they're clearly ill with something that might be COVID? So they're asking here, what should our approach be allowing patients to be discharged into care homes who are symptomatic of COVID-19? The answer, of course, should be you'd test them, but the government specifically said no need for a test. My working assumption was that we would have to allow discharge to happen and have very strict infection control. I don't know why that's a question mark. Otherwise, presumably the NHS gets clogged up with people who aren't as acutely ill. So what they're basically saying here is that there needs to be some sort of control in the care homes to isolate these people. Otherwise, they'd end up remaining in hospital, and because they're not acutely ill, in other words, they don't need hospital treatment, that would clog up the hospitals. That was their fear, clogging up the hospitals. And why was that a fear? Because it would expose to the public that the Tories had run the NHS down. Then it says a big ethical issue for care home providers who are understandably very concerned and are already getting questions from family members. I'm also copying in various people who were also officials within our healthcare, the top of our healthcare. So then came the reply. The reply was Morning Ross. This is the same day, a few minutes later. Whilst the prospect is perhaps what none of us would wish to plan for, I believe the reality will be that we will need to discharge COVID-19 positive patients into residential care settings for the reason you have noted. So that is before even the first lockdown. This is early on during the first wave. This is the 16th of March. This is someone at the top here who's not a politician, but are being directed by Matt Hancock, basically, acknowledging that they're going to be sending COVID positive people into care homes, right? Says this will be entirely clinically appropriate because the NHS will triage those to retain in acute settings who can benefit from that sector's care. No. The numbers of people with disease will rise sharply within a fairly short time frame, and I suspect makes this fairly normal practice and more acceptable, but I do recognise that families in care homes will not welcome this in the initial phase. No, because it killed 20,000 of them. That is why. But that is an email showing really very, very clearly that they knew they were sending COVID positive patients into care homes. And I'll something else before I come to the comments, I'll notice this Ross here was talking about controls in care homes. It says, my working assumption was that we would have to allow discharge to happen and have very strict infection control. There was no infection control. Care homes couldn't provide infection control. Didn't have the capacity. We have a privatised care home system in this country. Everyone's rammed in like sardines. So there was no way of isolating COVID. And the care homes weren't even told if their patient was COVID positive either, because there was no test. There was no COVID test before being discharged. Because if there had been a COVID test, you could say arguably it would have been better clinically, because the care homes would have known which patients were ill with COVID and which ones were not. But at the same time, that would have been unacceptable to the public because then there'd be a record of the government discharging COVID positive patients to care homes. So, you know, it's no wonder absolutely loads died. And this should be all over the news. Absolutely all over the news. This is, you know, this is like, should be really, of many, many bombshells to come out of this COVID inquiry, this should be the biggest one. Because the government made all those arguments, oh, we threw a protective ring around care homes, and it was lies. No, they did not. They threw them to the wolves. Gary saying they didn't care about doing COVID tests. I had to phone every day for a week to get a test for my mum. No. I mean, Michael Gove was saying this week, was it yesterday or the day before? I think it was the day before. That, you know, I mean, he was listing all the things the government got wrong, which was almost everything. And he said the testing strategy was all bollocks. You know, he said it was all wrong. They could have discharged to isolation hotels or unused Nightingale beds. There's things they certainly could have done, yes, if they gave a shit, and they didn't. You've got to remember, I mean, at the time, morning, Blase, at the time, Boris Johnson, remember, we've seen plenty of evidence. Boris Johnson had no regard for these lives. Oh, they've had a good innings, he said. They've had a good innings. So that was the attitude of government. You know, there was no, like, their theory, what they were sort of saying to each other to make themselves feel better is, well, what we'll do is we'll let COVID run through the healthy population who won't die from it, even though I mean, that was still a mad thing to do. I mean, given what we know now, we know that even when you survive it, you are worse off. You are physically weakened as a result of it. You're not stronger for the next infection, weaker. But the attitude at the time, we'll let it run through the healthy population who will just take it on the chin, and then we'll shield the vulnerable people, which they didn't do. But that was the theory. We'll shield the vulnerable people, let the virus burn itself out, get this herd immunity, which basically doesn't exist in the concept as it was being described to the public. And then we'll have dealt with it. But it was absolute nonsense. From a scientific point of view, absolute nonsense, even to someone like myself who's got, in terms of biological qualifications, A levels. You know, my degree's in physics. I did do some biology at university, but that was genetics. So yeah, it was an absolute nonsense from the start. But again, here is the proof that they knew what they were doing. Absolutely knew what they were doing. William saying they discharged patients to alleviate demand for beds, and in doing so exponentially increased demand for beds. Yes, that it was all to stop the public finding out that everything was designed. Everything was done just to stop the Tories looking bad. It was a PR exercise. The whole COVID thing was, well, it was not. Some of it was a looting exercise as well, but it was a PR exercise to stop people finding out how much they'd trashed the NHS. As if the annual NHS winter crises, which again, you know, are in full flow at the moment. What's it on the front page of the Mirror today? Something like 50-odd% of, let me find it. 54% of casualty units are already failing. And we're not even into winter yet. We're basically just getting started. Between the care homes and the community nurses, it was bound to go wrong. Well, you had, I mean, you were discharging, they were knowingly discharging COVID positive patients to care homes without telling the care homes they were COVID positive, because no one knew, they weren't testing them. So that actually made it worse for the care. Like, what were care homes supposed to do? Even if, let's say it were possible to have isolated conditions for some of their residents, right? Let's say, which for the many care homes will not have been the case, but let us say they didn't know which ones were positive. They didn't know. If one of them had symptoms, they may have erred on the side of caution if they had that capacity, which many didn't. But if they were asymptomatic, they had no idea. They were, you know, if I remove this as just a typical picture in a care home, they were all crammed together like this. And the care home staff, I mean, like, frontline NHS staff didn't have PPE, famously putting on bin bags and stuff. Care home staff, who are not used to wearing much PPE, they had nothing. So you also had care workers, some of which were passing between care homes and people having residential care, care in their own homes. So they were passing between different households without any PPE, and they weren't being tested either. Care workers were not being tested early on. The whole thing was incredibly. If you worked on the principle that the government would have liked to have saved lives, it was incredibly reckless. But then, we find all the evidence that at the very least Boris Johnson and possibly several other senior members of the government didn't care about the lives at all. They had no thought at all about them. Watching this with gritted teeth at the callousness of their decisions. The thing that's upsetting me the most is the fact that the public are still not being informed of it. All of this was obvious at the time. It was obvious at the time because I did a video on it at the time. It was there in black and white. The official policy was that negative COVID tests would not be required of patients being discharged from hospital into care homes. It was there in black and white. It was there to see. That was government policy. We knew at the time, and I mean knew, not suspected, knew that people were being moved from hospital to care homes without needing a negative COVID test. So it was obvious that COVID positive people were going into care homes. And it was obvious that those care homes would not know about it. Some of the people that were being discharged to care homes as well were just literally dumped outside the care homes. The care homes were sometimes saying, hang on a minute, there were some care homes saying, we want them to have a negative COVID test before, but they were brought to them anyway. They were just left on their doorstep. They said, right, well, they're your problem now. So this wasn't even, it wasn't even the care homes going, oh, all right then. Some of them were really against this. And so we knew it all at the time. It was very obvious at the time. When we could see people dying in care homes on an industrial scale, it was obvious. It was all obvious. It should have been reported at the time. But the fact that we have this email now, or these two emails, where they're talking very openly about the fact that, one, they're going to be sending COVID positive patients. It says there, we will need to discharge COVID-19 positive patients into residential care settings. It says it there in black and white. The head of the UK Health Security Agency, for goodness sake. I can think of nothing worse for our UK health security than doing something like this. And so they've said that they knew that they were doing it, and yet nowhere in that email is how we're going to stop this, like, killing lots of people in care homes. Because this Ross person actually asks. They say about the strict infection control. Where's the reference to strict infection control in the reply email? It's not there. It's not there. If you want to see these emails, by the way, there is a link in the description below, right at the bottom of the description below, to them. But yeah, the policy was online for months. After March 2020, they didn't attempt to hide it for a long time. Yeah, they eventually changed the policy, and it was, as you say, months later. I mean, all advice like this has to be published. They can't hide it. Because what's the point of hiding it? There's so many people who have to follow this advice, this guidance, that it has to be published. Which is then how, nosy bastards like me will just go along and find it and do a video on it. Batman said, Phil, realise you aren't necessarily a legal expert, but how likely is that any sort of justice will be done for this flagrant negligence? Feels like there's no apparatus for accountability. There is, it's just poorly funded. The National Crime Agency would be the obvious one. If there is any possibility of criminal laws being broken for, as you say, negligence, you're right, I'm not a legal expert. The obvious one to go for is something like this is... misuse in public office or something like that. But if there is any possibility of a criminal case, what I would say is my understanding of the law is two things. First of all, nothing will happen while this inquiry is going on. So basically, investigations tend not to overlap. So while this The COVID inquiry is not going to press charges. It is purely a civil matter. But the COVID inquiry is gathering an awful lot of evidence which could form part of a criminal investigation. The COVID inquiry is not going to be over for years. Do not expect it to be over. The inquiry. So if there's going to be a criminal investigation, first of all, if you want some hope for it, when the COVID inquiry is over, Labour will be in government, and obviously it's not in their interest to lean on the NCA to stop investigations. So it'll be down to the National Crime Agency whether they launch investigations or not. They will have already had. They won't have to find lots of evidence. The evidence will be there for them. It won't happen until the COVID inquiry is over. Now, it could, in theory, happen before the COVID inquiry reports. The COVID inquiry will, of course, take about a year or year and a half to publish its findings once it's over. It takes a very long time to go through it all. As I understand it, there's nothing to stop the criminal investigation going on. They don't have to wait for the things to be published. So there is a possibility. I can't possibly judge how likely it is. I've not seen actual legal experts comment on that either. So they probably don't know. Otherwise, I think someone would have done. At least Jolyon Mohan would have done, you would have thought. But yeah, something like this, it was criminally negligent. To be able to know that you are, because as you say, there were other things they could have done if they were at least open with the public. If they just, it required them to be able to say to the public, look, we didn't, even though we knew a global pandemic was the number one threat to the nation, we deliberately made sure the NHS didn't have the capacity to cope. That, of course, is electoral suicide. So that's what they were focusing on. But at the same time, it does mean that they fundamentally failed in their first duty of government, which is to protect the public. The Tories didn't care. Johnson didn't care. The cabinet didn't care. Well, one of the most interesting things about the thing was a suggestion that was this. I can't remember. It might have been Michael Gove who said it, but someone has said this week that one of the big problems was that the cabinet was so inexperienced. The cabinet was chosen for its loyalty to Johnson rather than experience or competence as well. And that experience can be for anything. You've got to bear in mind, we're not talking about people who just weren't experienced in government. I mean, after the next election, we're going to have a cabinet that is completely devoid of experience in government, or almost completely devoid. Yvette Cooper, David Lammy. So there'll be a few who were in the last Labour government, but not senior members of that government. But we're going to have an inexperienced, but they're not inexperienced in like life. You know, several of them have done a lot of things, whereas the cabinet we had in 2020, like what had they done? The members of the cabinet, what had they done? Some of them have been in Parliament for a long time, but hadn't really done anything. They hadn't even been like senior members of select committees or anything like that. So they had no strings to their bow. They had no experience as project managers in any capacity. But anyway, carry on the comment. It says, Tories think the electorate's expendable and should be left to fund themselves despite paying record taxes. Yes, I mean, as far as they have this born-to-rule mentality. It's a born-to-rule mentality. You know, they still live in as if it's feudal times. And they're born into a particular family, and therefore that gives them the right to rule and to take whatever they like as tribute. Labour should change the law so they can be prosecuted if necessary. You can't change a law and then apply it retroactively. That would be a political witch hunt. Can't do that. What Labour can do, and what I've suggested they should do, is on day one, Yvette Cooper should go to the National Crime Agency and say, right, we're going to make sure you're properly funded. And obviously she'll have to square it with Rachel Reeves first, but we're going to make sure you're properly funded. And she can just say to them, as a general thing, she doesn't require any response from them, if over the last few years you feel that you have been prevented from pursuing certain criminal investigations because of political interference, let me assure you that political interference has ended today. That's all the Labour can do. They mustn't get themselves directly involved in this. There must not be any political dimension to any investigation. All Labour should do is to say to the National Crime Agency, have a meeting on day one and say, look, we're going to make sure you've got adequate funding. And if you think there's been any political pressure that has constrained you in the past, that political pressure will be disappearing. I will not be telling you not to pursue criminal investigations. You will have our full support and you will have proper funding. And then it'll be up to them. Because I don't know, and I can't even suspect whether any of this, is it the result of, because we know that in any other context, we know if people like Matt Hancock and Boris Johnson were executives of corporations, we know that there would be criminal charges. We know that corporate manslaughter would be very much in the equation. But what we don't know is, do those same laws really apply to politicians? They may not. Because the law, remember, is set by politicians. Now, what Labour can do is, if it's not clear that criminal law has been broken, Labour could change the law to say, right, if ever this happened again, then there would be criminal charges. So Labour can do that, and there's political benefit in doing that, because then they're drawing attention to the fact that the reason they're changing this law to put a greater level of responsibility on ministers is because at the moment ministers can literally get away with murder. You know, Keir Starmer can actually say that to the public. It's very obvious from the COVID inquiry that ministers can literally get away with murder, and that's not right. We are going to make them criminally responsible for these decisions to the same level as an executive of a corporation. They'll be at least at the same level. They'll be just as responsible. That way, he'll be highlighting the fact that, you know, ministers were basically criminally negligent, only protected by the law. But they won't be able to apply that retroactively, because, you know, you can't have a law change and then someone arrest you for doing something that was legal at the time. Right-wing libertarians do not believe the government has any duty of care to the population. No, because whatever care the government needs to exercise, they would generally pay for themselves anyway. Indeed. You know, very wealthy people weren't falling foul of this. If a very wealthy person had COVID in hospital, they would be discharged home, and they would get themselves a COVID test and isolate themselves from the rest of their family. And they would have servants who would be PPE'd up and to attend to them, and that would be fine. So very wealthy people didn't, if they wanted to protect those nearest and dearest to them, could have done. They would have had the option to do that. Ironically, libertarians probably killed a fair few of themselves off because of their generally reckless attitude, this sort of attitude that they can ignore not only people but viruses. Alan reminding people just to click the like button there. Yes, do that. A country can't operate without essential workers, but they're paid the lowest. Who would miss the PM if we took a year off? Oh no, we would. We do need a prime minister, even a bad one, because otherwise literally nothing happens. No. We actually do need a prime minister. Like, as bad as they've been, even like Rishi Sunak is still better than literally not having a prime minister. DJ Bert, £5 super chat, thank you very much. F the Tories, have a brew. Has to be for Graham. I have Apple Tango today. Just announced Johnson next week at COVID inquiry. Will he bluster? Well, so we knew he was giving evidence in December, and the way it's going, yes, next week I think was likely. He is going to be under oath. He is going to be under oath. Now, this is very interesting because regarding what I've just said about criminal investigations, remember, none will begin while the COVID inquiry is underway. Now, I wonder how many of them may be sweating a bit when the COVID inquiry ends, because at the point at which, in theory, the National Crime Register could get involved, that might be squeaky bum time for some of them, because they won't have any power over them. Labour will be in power. You know, it'll be quite interesting. I'll tell you what might be a bit of a giveaway. If, as we're getting close towards the end of the COVID inquiry, if the Tory press start talking about, Labour, there's a secret plan by Labour to organise a witch hunt out of revenge against Boris Johnson or something like that. If we start to see headlines like that, then you'll know he's worried, because they'll be doing it to try and change public opinion, so that if there is an investigation, people think that it's Keir Starmer who's ordered it out of some petty act of revenge or something. So that's when we might sort of find out. But yeah, Johnson does have to be a bit careful, because he's under oath. It has power of perjury if you lie, same as with the Privileges Committee. And it's going to be quite interesting, because, well, very interesting. I mean, there's an awful lot of things that he has said. The same applies to Rishi Sunak, actually. There should be more emphasis on Rishi Sunak. Rishi Sunak has said things in his witness statement. He's submitted it to the COVID inquiry that has been contradicted by a great many people. So Rishi Sunak, for example, seems to have lied in his evidence. But Boris Johnson is very likely to as well. And the thing is, he's going to be dealt with by a judge. And we saw, for those who watched, for example, Michael Gove this week, or if you watched any of it, he was very much wasting time. He was like, filibustering is the word I've used, seem to describe it, which is more used in relation to political debates, but he has absolutely been. And they were getting very frustrated with him. The lead counsel was getting frustrated. The judge was getting frustrated with him. And they go, will you answer the question? It says, well, do you want a quick answer or do you want a full answer? And it's like, you're not given an answer at all, you bastard. So Michael Gove was there, but Michael Gove is canny, and he can do that. I'm not sure Boris Johnson is as cunning, so we'll see what happens. We'll see what happens. But the squeaky bum line, by the way, is a Sir Alex Ferguson line. But Sunak's the biggest snake. Well, he's the more relevant one. I mean, ultimately, Boris Johnson is most responsible for this. You know, when it comes to our pandemic response, Boris Johnson is the most direct. A lot of them have responsibility, but Boris Johnson is the most directly responsible. He was not just the Prime Minister at the time, but he was the Prime Minister who dissolved our pandemic response unit. And he was the Prime Minister who, even when the pandemic hit, did not start it up again. And we still don't have one now. The fact that we were poorly prepared was Boris Johnson's fault. The fact that we made the wrong decisions at the time, and obviously I don't just mean got it wrong, I mean deliberately made the wrong decision at the time, was Boris Johnson's fault. And the fact that we're actually even less well prepared for a pandemic now than we were at the start of it, instead of stronger, you should be stronger, shouldn't you? I mean, what happened when we got hit by BSE, 20 odd years ago, whenever it was, 25 years ago, something like that. We got hit by BSE in this country. In fact, it was longer than that. Doesn't matter. What happened? We boosted our systems to the point where British beef became pretty much the safest in the world. Because we'd been caught out. We got caught out. We looked stupid. It had damaged our economy. So what did we do? We put measures in place to make sure that we had the highest standards in the world. What have we done with COVID? We got caught out. Have we now got amongst the highest standards in the world? No, we have not. We are worse off. We are less well prepared for the next one. That is all Boris Johnson's fault, ultimately. But Rishi Sunak was also known to have been reckless at the time. Not just eats out to help out. He was known to have sort of been on Boris Johnson's side in wanting lockdowns, delayed or eased more quickly, and things like that. He was reckless as well. And of course, because he's the current Prime Minister, who is still not doing anything to get us ready for the next pandemic, then he is snake number 2, we could say. Sunak as a political beast is a Johnson creation. Well, effectively, yes. I mean, Johnson, of course, promoted Sunak to, first of all, Chief Secretary to the Treasury and then Chancellor. Absolutely. I mean, Rishi Sunak would still be lingering somewhere on the back because he wouldn't have, he's not a good politician. So he couldn't have attracted enough of a following in Parliament without being heavily promoted by Boris Johnson. So, yes, it is fair to say that Rishi Sunak is a Boris Johnson creation. Anyway, do you know what? We've completely run out of time. I've forgotten to note the time. And I do actually have to get videos done today because we're going out for lunch today. But thank you very much for coming on, everyone. As I say, if you want to see these emails, they are, I've linked it in the comments below. It's appalling to me that this is not front page news. Absolutely appalling. But also not surprising. But anyway, thank you very much for coming on. Don't forget to click the like button and to subscribe and to check out the various other links in the description below. Have a very good day. And until next time, I'll see you later.